It's time for us to resist. They can't arrest all of us. They can't keep all of your kids home from school. They can't keep every government building closed, although I've got a long list of ones they might keep closed or might ought to keep closed. We don't have to accept the mandates, lockdowns, and harmful policies of the petty tyrants and bureaucrats. We can simply say no, not again. Nancy Pelosi, you will not arrest or stop me or anyone on my staff from doing our jobs. We have either had COVID, had the vaccine, or been offered the vaccine. We will make our own health choices. We will not show you a passport. We will not wear a mask. We will not be forced into random screenings and testings so you can continue your drunk with power reign over the Capitol. President Biden, we will not accept your agency's mandates or your reported moves towards a lockdown. No one should follow the CDC's anti-science mask mandates. And if you want to shut down federal agencies again, some of which aren't even back to work yet, I will stop every bill coming through the Senate with an amendment to cut their funding if they don't come back to work in person. Local bureaucrats and union bosses, we will not allow you to do more harm to our children again this year. Children are not at any more risk from COVID than they are from the seasonal flu. Every adult who works in schools has either had the vaccine or had their chance to get vaccinated. There is no reason for mask mandates, part-time schools, or any lockdown measures. Children are falling behind in school and are being harmed physically and psychologically by the tactics that you have used to keep them from the classroom during the last year. We won't allow it again. If a school system attempts to keep children from full-time in-person school, I will hold up every bill with two amendments, one to defund them and another to allow parents the choice of where the money goes for their child's education. Do I sound fed up to you? That's because I am. I'm not a career politician. I practiced medicine for 33 years. I graduated from Duke Medical School. I've worked in emergency rooms. I've studied immunology and virology. And I ultimately chose to become an eye surgeon. I've been telling everyone for a year now that Dr. Fauci and other public health bureaucrats were not following the science, and I've been proven right time and time again. But I'm not the only one who's fed up. I can't go anywhere these days without people coming up and thanking me for standing up for them, whether I'm at work or at events in Kentucky, at airports, in restaurants, or in stores. People thank me for taking a stand. They thank me for standing up for actual science, for standing up for freedom, for standing against mandates, lockdowns, and bureaucratic power grabs. I think the tide is turning. As more and more people are willing to stand up. I see stories from across the country of parents standing up to the unions and school boards. I see brave moms standing up and saying, my kids need to go back to school in person. I see members of Congress refusing to comply with petty tyrant Pelosi. We are at a moment of truth and a crossroads. Will we allow these people to use fear and propaganda to do further harm to our society, economy, and children? Or will we stand together and say, absolutely not, not this time, I choose freedom?
For what purpose does the gentleman from North Carolina seek recognition?
Madam Speaker, I seek unanimous consent to address the House for 1 minute.
Without objection, the gentleman is recognized for 1 minute.
Madam Speaker, you are not God. Your will does not bend the forest or shake the mountains. And let me assure you, your will does not bow the knee of millions of my countrymen who refuse to heed your callous command. To threaten arrest on others for their own personal medical decisions is nothing short of a medical apartheid, and I will not let it stand. For if I am to cowardly bend the knee here like those on the left wish, then what is to stop you all from taking your tyranny to the rest of this country that I love? How dare anyone in this institution attempt to dictate to the patriots of my staff how they may live their lives? For one to think that because they have the title honorable attached to their name means that they may dictate what others may say and think repulses me. What makes this nation special is that in this free land, the people are the royalty. So arrest us if you will, but I will not cower and I will not bend. Madam Speaker, you have come to take away our liberties. But Madam Speaker, in this country, you are outnumbered. With that, I yield back.
Dr. Dan Stock, 5777 West 700 North, McCordsville, Indiana. To address your comment, gee, it's hard to believe we're 18 months into this and still having a problem, and I would suggest the reason we still have a problem is because we're doing things that are not useful, and we're getting our sources of information from the Indiana State Board of Health and the CDC, who actually don't bother to read science before they do this. I'm actually a functional family medicine physician. That means I am specially trained in immunology and inflammation regulation, and everything being recommended by the CDC and the State Board of Health is actually contrary to all the rules of science. So things you should know about coronavirus and all other respiratory viruses: they are spread by aerosol particles, which are small enough to go through every mask. By the way, the literature that supports all of that is in a flash drive that we presented to you. It's been given to the Secretary. As a matter of fact, it quotes at least 3 studies sponsored by the NIH to that exact fact, even though the CDC and the NIH have chosen to ignore the very science that they paid to have done. That is why you keep struggling with this, is because you cannot make these viruses go away. The natural history of all respiratory viruses is that they circulate all year long, waiting for the immune system to get sick through the winter or become deranged, as has happened recently with these vaccines, and then they cause symptomatic disease. Because they cannot be filtered out and they have animal reservoirs, and this is a very important point, no one can make this virus go away. The CDC has managed to convince everybody that we can handle this like we did smallpox, where we could make a virus go away. Smallpox had no animal reservoirs. The only thing it learned to infect was humans. That's why we were able to make that virus go away. That will not happen with this any more than it will with influenza, the common cold, respiratory syncytial virus, adenoviral respiratory syndromes, or anything else that has animal reservoirs. So the reason you can't do this is because you're trying to do something which has already been tried and can't be done. Equally important is that vaccination changes none of this, especially with this vaccine. And I would hope this board would start asking itself, before it considers taking the advice of the CDC, the NIH, and the State Board of Health, why we are doing things about this that we didn't do for the common cold, influenza, or respiratory syncytial virus. And then ask yourself, why is a vaccine that is supposedly so effective having a breakout in the middle of the summer when respiratory viral syndromes don't do that? And to help you understand that, you need to know the condition that is called antibody-mediated viral enhancement. That is a condition done when vaccines work wrong, as they did in every coronavirus study done in animals on coronaviruses after the SARS outbreak, and done in respiratory syncytial virus, where a vaccine used in a vulnerable individual done the wrong way, which cannot be done right for a respiratory virus which has a very low pathogenicity rate, causes the immune system to actually fight the virus wrong and let the virus become worse than it would with native infection. And that is why you are seeing an outbreak right now. In fact, in that flash drive you're going to have coming to you and in the emails with 6 extra will be a study showing that 75%. That is why you are seeing an outbreak right now. In fact, in that flash drive you're going to have coming to you and in the emails with 6 extra will be a study showing that 75% of people who had COVID-19 positive symptom cases in Barnstable, Massachusetts outbreak were fully vaccinated. Therefore, there is no reason for treating any person vaccinated any differently than any person unvaccinated. You should also know that no vaccine, even the ones I support and would give to myself and my children, ever stops infection. In 2014, there was outbreak of mumps in the National Hockey League. The only people who came down the symptoms were the people who were unvaccinated or unknown vaccine status. Boy, that sounds like a great argument for vaccines. But a question that you should ask yourself, knowing that half of the people who came down with symptomatic disease had no contact with an unvaccinated or unknown vaccine status individual, where did they get the disease? And the answer was from the vaccinated individuals. No vaccine prevents you from getting infection. You get infected, you shed pathogen. This is especially true of viral respiratory pathogens. You just don't get symptomatic from it. So you cannot stop spread. You cannot make these numbers that you've planned on get better by doing any of the things you're doing, because that is the nature of viral respiratory pathogens. And you can't prevent it with a vaccine because they don't do the very thing you're wanting them to do. And you will be chasing this the remainder of your life until you recognize that the Center for Disease Control and the Indiana State Board of Health are giving you very bad scientific guidance. And instead, read the articles that are going to come on the email and are on this flash drive, and listen to the people in this audience here tonight who actually have recognized the advice they are getting from the CDC and the NIH is counterfactual. And that's why you're still fighting this with this vaccine that supposedly was going to make all of this go away, but has suddenly managed to make an outbreak of COVID-19 develop in the middle of the summer when vitamin D levels are at their highest. By the way, the other thing that would be necessary, any vaccine restriction to be considered, is if there were no other treatment available. And I can tell you, having treated over 15 COVID-19 patients, that between active loading with vitamin D, ivermectin, and zinc, that there is not a single person who has come anywhere near the hospital. And we already have studies that show that if you achieve a 25 hydroxyvitamin D level greater than 55, your risk of COVID-19 death will drop down to 1/4 of the population average for the United States. And there are active treatment trials included on that flash drive that show the same is true. So if you were going to discriminate based upon vaccine, you should also discriminate based upon 25 hydroxyvitamin D level, zinc taste test response, and probably previous infection, since there are also studies on that flash drive that show that people who have recovered from COVID-19 infection actually get no benefit from vaccination at all, no reduction in symptoms, no reduction in hospitalization, and suffer 2 to 4 times the rate of side effects if they are subsequently vaccinated. Therefore, the policies that you are basing on are totally counterfactual. I don't blame this board for that because I know you aren't scientists and you've thought you're basing on are totally counterfactual. I don't blame this board for that because I know you aren't scientists and you've thought it was reasonable to listen to the CDC, NIH, and the Indiana State Board of Health. But I would encourage that instead you listen to the people out here in this audience and read what's on that data drive. And if anybody here in this board has any questions about anything on that, I will happily come back and sit with you individually if you would like to explain the science behind this. And if you're worried about being sued by somebody because you don't follow the guidance of the CDC and the NIH, I will tell you have a free pro bono expert testimony at your disposal. I will testify in defense of this board, turning down all these recommendations for free at any time in any court. Thank you.
Thank you. Thank you.